We can't have a system that works better for the insurance companies than it does for the American people. We need to give families and businesses more control over their own health insurance, and that's why we need to pass health care reform. Not next year, not 5 years from now, not 10 years from now, but now.
President Obama in Pennsylvania this morning setting another new deadline on health care.
And it's looking really, frankly, fired up and ready to go, taking on the insurance companies, I think in the harshest light we've seen yet. Now, Top Line begins right now.
Hello and welcome to ABCNews.com's Top Line. I'm Rick Klein.
And I'm Jonathan Carl.
Every day at noon Eastern Time, we're right here to bring you the latest reporting and insight and analysis, everything you need to know about politics. And it's twitter.com/thenote to stay in touch all day long. And Jonathan, lead us off. What do you got?
Healthcare deja vu. Now, I think for either the third or maybe it's the fourth time, we have the final push from President Obama to get health care passed. But as I mentioned, this was a very sharp-edged speech we saw today, just ending, and taking on the insurance companies. He's got new ammunition with this Goldman Sachs conference call talking about how, we're going to raise premiums, that can drive customers away, but we don't need to worry about it because there's not that much competition. I mean, he's really going at the insurance companies.
That's right, and they found the foil, I think, that they may not have had at several previous iterations. This is the last push. There's no more redoing this thing. It either happens this month or it really doesn't happen at all, and I don't think the White House makes any bones about that fact at this point. Rahm versus Axe. That's right. It's palace intrigue and has reached a fevered pitch over the weekend. David Axelrod sitting for a profile for the New York Times. There'll be another profile in the New York Times Magazine next weekend of Rahm Emanuel. And this is all with lots of people going back and forth saying that there's infighting at the high levels of the White House. Al Hunt from Bloomberg News gets an interview with both men, and they sing Kumbaya and say everyone's friends. White Houses hate this kind of thing. And in fact, we learned that President Obama has told both men to kind of, and all of his advisors, kind of pipe down on all of this. But it's the broader context of the healthcare battle.
Yeah, and what I love about that Al Hunt thing is basically he got a call from the two of them. He was working on something, and they both called conference call.
How about that?
Hey, we're all fine. Everything's great. All right, next up, it's Starr versus Cheney. That's Ken Starr versus Liz Cheney. Liz Cheney has made a big issue out of the fact that there are 7 Justice Department lawyers who worked as defense counsel for various terrorist defendants. And Ken Starr has now joined with a lot of other Republican lawyers saying that this attack is unconscionable. I mean, really strong language here, saying that it is unjust and destructive to be taking these on, pointing out that defense of unpopular defendants is really part of what American justice is all about, going back to our friend John Adams, defending the Boston Massacre, the British soldiers of the Boston Massacre.
That's right. He hasn't been on the program yet, John Adams, so he doesn't get that moniker. But this may be where Liz Cheney's maybe gone a little too far. And you're seeing some pushback from lawyers, Republican lawyers, saying this is really not a legitimate area of criticism. So be careful as you launch these. Somehow I think Liz Cheney's not going to back down, though.
No, I don't think so. She's not big on backing down.
And finally, pivotal moment. Elections have taken place over the weekend in Iraq, and this is a major moment not just for Iraqi democracy, but also to judge how Iraqi security forces are handling the situation. Obviously, there is a timeline for troop withdrawal. Americans watching this very carefully to see whether the Iraqis can handle this and whether they're going to need any additional help, whether any adjustments. So far, it looks like American officials saying this looks like we can keep to our previous timelines.
Yeah, and there have been a lot of attacks. I mean, there have been, if we had anything like this, this would be complete chaos and disaster. But it's considered, to all things considered, gone pretty well. So, so we'll see. What Ray Odierno, the top general in Iraq, said today is that they are on schedule to get down to 50,000 troops by the end of the summer. Still remains to be seen whether or not they will actually be able to have full pull-out by 2011.
Indeed. Well, we begin with healthcare, and we're joined now by Neera Tanden, the Chief Operating Officer, new job over there at the Center for American Progress, and until recently a top Obama administration advisor on healthcare reform. Thank you for being with us. Let's start with healthcare. You're looking at the context of all this developing. You were there at the front lines over the first year of this. What went wrong in your mind that we're still talking about healthcare? Now it has to get done by April instead of last August.
Well, I mean, healthcare is a very tough issue. People feel very passionately about it. Each of us have a healthcare story. It's about our mother, it's about our children, it's about our grandparents. And at the same time, it's a very complicated issue, right? It's, pre-existing conditions, covering lots of people. It's a very large bill. It's a very large, complicated issue that works together. So you meet a complicated issue with something that people can feel very passionately about, and it's very easy to demagogue. So I think part of the problem has been communicating what the president's really passionately feels about this issue, what he cares about, and I think that's what he did today. He really wants people to understand what's in it for them, and part of what's in it for them is to basically have some power over the insurance companies. All of us are a victim to premiums jumping at rapid rates, and so that's why I think today he's really trying to bring the message home and make it clear to people and crystallize what it is, what's in it for them.
So what's your level of optimism right now that he'll find the votes he needs to pass it out of the House by March 18th?
I'm as optimistic as I have been since Massachusetts. I think really.
That's a carefully crafted sentence there.
I think really basically the leadership in Congress, the president, Democrats recognize we're going to be hit with this bill one way or the other. We might as well have a defense to it by passing the legislation. And that's why I think you're seeing more moderate Democrats sort of step up to the plate and recognize that it's something that we need to go forward with. And when Nancy Pelosi calls the vote, she'll have her work cut out for her, but she didn't have the votes before.
Can you give me a percentage chance that it passes?
I'm going with 75.
75.
All right, that sounds like optimism. Now you went through this. It must feel like deja vu to you in some ways. You went through this in 1994 at the front lines with Hillary Clinton, and that was a much different strategy, as you know. It was presenting a series of principles and legislation to Congress as opposed to letting Congress craft this. Is there a happy medium? Are there lessons out of this to say, well, really the way to get this done is taking some from column A, some from column B, or is it how we're always going to be dealing with health care in this country?
Well, I think one of the things that people forget is that the president put forward a pretty detailed campaign proposal. And the Senate, back over a year ago, sort of developed that already. Max Baucus worked off the president's plan. So we were in a different place. We had had a 2-year debate on health care reform. People had really understood that there was some, the president really wanted to do this. And so he was able to sort of push the Congress for them to develop the legislation. Obviously, we all wish it had gone faster, but this is a big piece of legislation. It takes a lot of time. And, obviously you can look back on things and wish it went a little bit faster because we want it to be done, before Christmas break, and we're not there yet. But.
One mystery for me was the obsession with the public option. We wasted months and months arguing over this. Ultimately, it failed, and yet chewed up all that time. I mean, this was not a central part of the president's or the candidate Obama's campaign plan.
No, it wasn't a central element of anyone's campaign plan. It wasn't his. It was an important part, but it wasn't. It wasn't the driving force. And I think that it became something that liberals could really hold on to. And what's actually as important, if not more important, is whether there's enough subsidy in the bill, whether people can really afford health care.
So was it a mistake to spend so much time fighting over the public option?
Well, I think it became something that people sort of glued onto, and that's one of the reasons why it became so debated. I mean, how many times did you guys talk about, the life or death or life and death of the public option? And at the end of the day, I think what's most important is that there's real reforms of the insurance market and that we can move forward. Because this will be, when we cover 30 million Americans, it will be historic progressive change that liberals should support.
As you may have seen, Mark Penn, the pollster who worked for Hillary Clinton, as you did in 2008 in the campaign, has an op-ed today. He says Republicans have turned this into a Dirty Harry moment, like Democrats saying to Democrats, make my day and pass health care, daring them into passing health care. What do you make of the politics of this? Do you see a danger for Democrats if they go forward with this, given Massachusetts, given the way that the public opinion polls have gone forward? Do you think that there is an argument here for Democrats to make?
I think the most important thing is for Democrats to show leadership. They've talked about an issue for a year. They've told every American this is a catastrophe. To walk away now would be to show that we are not capable of governing. And that would be an indictment for this election and for elections to come. And so I think people can look at the temporary moments, the polls, the legislation is not as popular as it once was, but we have the opportunity and the obligation to explain to the American people why we spent a year of our lives working on this. Everyone's tired of it, but we're close to the finish line. And if we fail now, we will not fail for just this election, we will fail for elections to come.
We're almost out of time, but I wanted to ask you, the person in the cabinet who knows more about health care reform and how to get it passed and how the problems in trying to do so is Secretary Clinton. Is it your sense, have they privately through back channels, the president talked to her about this, gotten her advice on how to proceed? Obviously, she's got a pretty big day job.
Yeah, she's got a big day job. I know that the president and her talk about every issue under the sun. I'm very confident they've talked about health care reform. She's a brilliant policy wonk on this issue, knows the ins and outs, and I'm sure the White House has used her advice and counsel.
Is she just as frustrated as everyone else watching this?
Well, I'm not going to speak to her level of frustration on this issue.
Okay.
We're all a little frustrated.
Fair enough, fair enough. Neera Tanden of the Center for American Progress, thanks for being with us. We really appreciate it and hope to have you back soon.
Great, thank you.